भाई उपेंद्र पंड्या, मुझे हार्ट की बीमारी थी लेकिन पता नहीं था क्या होता है वो। तो इंजीनियर ने बोला तो चेक करो, क्लियर चेक करने का बहुत जगह पे चेक किया। फिर मैं डॉक्टर पवन कुमार के पास आया, उन्होंने बोला कुछ वो नहीं है तुमको, तुम फिक्र मत करो। अरे सब लोग पूछता है तुमको हार्ट का प्रॉब्लम है, तो सब साफ बोला नहीं कुछ नहीं, फिक्र मत करो। उन्होंने 2002 में मेरा हार्ट का ऑपरेशन किया, नया वाल्व बैठाया। उसी दिन मैं खड़ा हो गया। बोले क्या करता है? बोले सर आपने बोले तो कुछ नहीं, बारी नहीं, आपका तो बहुत बड़ा ऑपरेशन, बड़ा भारी है। फिर मुझे उन्होंने संभाल लिया। आज 23 साल हो गया, मैं बहुत अच्छी तरह से जिंदा हूँ। आज चेकिंग के लिए आया हूँ सबके पास, और भगवान की दया, साहब की दया, अच्छी तरह से मैं आज जिंदा हूँ।
So here is Mr. Upendra Pandya, very dear patient of mine. He has had rheumatic mitral valve disease 30 years ago, and he was suffering from very severe mitral stenosis with the enlargement of the heart, and he was very scared about heart valve operation. So when he came to me in 2002, I assured him that this is a very normal operation and he will be all right after replacing his mitral valve. So he underwent mitral valve replacement surgery by me in 2002, and at that time he was 50-year-old. So I used mechanical heart valve to replace the mitral valve, his damaged mitral valve, and he is healthy and hearty. This time this week he came here for a routine checkup. So we got everything done. His echo shows his valve is functioning very fine. This is the clip of echo, which you can see here. His heart valve is working very well, and his heart function is 50%. So heart is functioning very fine. We did a fluoroscopy also, and fluoroscopy shows the valve leaflet movements, which are perfect in normal motion. And so both these investigations show that he is doing very well after 23 years of the heart valve surgery. Today he is what? कितना उम्र है आपका अभी? 77-year-old he is now. So 77-year-old, and he takes the blood thinner medicine regularly and keeps a check on his blood coagulation picture by doing PT-INR regularly. And this is the example that even mechanical valve has the very high success rate. 23 years of working prosthetic heart valve in a patient with maintaining PT-INRs regularly. So this is a success story, and one should know that mechanical heart valves can last as long as I have the results beyond 30 years. The valves are functioning very well, so nothing to fear if you are advised mitral valve replacement or aortic valve replacement. And if you have been in the younger age, you can safely undergo mechanical heart valve replacement surgery. Thank you very much.